system. And through that system, you will see a pop-up of all the areas in our county, all the places that are registered in MyTurn that can provide you an appointment for a vaccine. That will include the county health department and the 3 clinics I've mentioned. It will include other providers who have registered in MyTurn. At the current moment, many of the pharmacies that are getting federal doses are not registered in there, so you may also want to check at those places if that's your preference. But for registering for our clinics, MyTurn is now the place to go, and that is effective today. Tomorrow is when we are going to have next week's clinics available to register. Actually, it might have actually happened late this afternoon. So our plan is to sunset the registry. So everyone we had who had registered for an appointment in our old system is being taken care of. We've notified them of their opportunity, of their one last opportunity in the coming week to get an appointment. But anyone who newly wants to register for an appointment needs to go through MyTurn. And on that site, you will see the same clinics, but a different enrollment system. For a number of people who did register in MyTurn previously, when none of these clinics were available, we've come to learn that there are quite a few people who might think that they've been waiting for an appointment in the MyTurn system. We are trying to work with that entity to see if there's a way we can get all of those previous registrants notified, either of the clinics that are available to them now, or if they do in fact need to re-register through the MyTurn system, we will notify them. We don't want to see people languishing in between systems, so we're trying to work very hard on communicating with everyone who was in our registry, with everyone who's been sitting in the MyTurn registration system waiting for clinics, and we're also looking forward to more people taking advantage of this new opportunity. I do also want to point out that we still have both our phone assistance system to help, although we can only go so far in making an appointment for someone in MyTurn. So for people that don't have internet access and need that phone hand-holding appointment or phone assistance to make an appointment because of the lack of internet access, you can call MyTurn, and that phone number is 833-422-4255. Okay, and just a couple of more things I want to mention. For those 250 some odd families who've been affected by loss of loved ones from this disease, this is just small solace, but if you do need help with funeral arrangements, financial help, I do want to point out that there is a new federal assistance program for payment of some of the funeral expenses. This is made available through the Coronavirus Response and Relief Supplemental Appropriations Act of 2021 and the American Rescue Plan Act of 2021. It is offered through FEMA, the Federal Emergency Response Agency, and in order to take advantage of it, you need to get information from FEMA. We have that link also on our website. But the best way to access this is through their phone line, and that number is 844-684-6333. This is available Monday through Friday. It is an East Coast line, so though it's 9 a.m. to 9 p.m. East Coast time, please be aware that in our time that would be noon to midnight. So anyone who needs to take advantage of this opportunity for funeral assistance, that information is available both on our website and through the phone line. I do want to one more time mention that the county still has some funding available for recovery efforts. This is for small businesses who have been impacted by the impacts of this pandemic. The information, and I won't read this whole website, it's on screen, but this is where a business can go to get more information about this program. This program has already provided over $40,000 to small businesses. We've received 28 applications, and 25 of those have met the criteria and been awarded funding. The amount of funding varies depending on the size of the business, but up to businesses with up to 50 employees may take advantage of these small grants. They are grants, not loans, between $1,500 and $3,500. The application deadline is coming up. It is April 27th, so please take advantage of that. And just one final note. I received a request today from our county's blood bank that our blood donations are quite low at this time, so I want to use this opportunity to ask members of the public who can safely donate blood to please consider doing so. And with that, I'm open for questions.
Dr. Bornstein, we're hearing that there's shortages of the Pfizer-type vaccine, and people going on the county website are being directed where to get it outside of San Luis County. Is that accurate?
We've been receiving somewhat diminished supply both of Pfizer and Moderna for a couple of weeks. My understanding of why that has occurred is for a couple of different reasons. One is the federal allocation is being spread wider and further, especially to pharmacies as well as federally qualified health centers, so that the remaining states' allocation to distribute to local jurisdictions is somewhat diminished in the short term. That is going to be made up in the coming weeks. The other reason is the state of California to keep their mega clinics open that had been getting separate dose allocations, the Oakland Coliseum and LA. Those are doses that are being set aside from the state's allocation. Again, we expect this to normalize and for the volume of doses to go up of all products in the coming weeks. But we are seeing a decrease of Pfizer. Why Pfizer may be particularly unavailable in the coming week or two is because we had such a high volume of Pfizer versus Moderna 3 weeks ago, and we're now trying to always make sure that we make our second doses available. So our Pfizer allocation to be given to people who are just starting on their vaccination journey, first dose, is going to be decreased for the next week or two, and we hope that we will see that alleviated in the coming weeks.
And one more on blood donation. Who is safe to donate? If you've had COVID, when are you safe to donate again? If you've had a vaccine, when are you safe?
Yeah, so the blood bank will screen for active infection, but pretty much anyone who's not actively infected can donate blood, vaccinated or otherwise.
Dr. Bornstein, like you just mentioned that the county will be winding down its clinics. Do you have a timeline for that, and what does that mean for people who don't have insurance or don't have an ID?
Yeah, so it's not any time very soon. I don't have a specific date. It'll be a number of weeks. Community Health Centers of the Central Coast does provide services for people who are uninsured. Other providers do as well. I know that the tenant clinics and Dignity also continues to have doses allocated to some of their medical clinics. For people that don't have insurance, there is no payment in those settings. I know that most of the pharmacies are asking for insurance. That is for purposes of charging a administration fee. The vaccines are free. The administration fee is low cost, but nonetheless, for someone who doesn't have that money, we will continue to be an available resource on a more limited basis. We're continuing to do mobile clinics. We're continuing to do pop-ups in areas of need, and there are these other resources I mentioned in the healthcare community.
I also have a question about some of the Cal Poly data, because we've noticed that the Cal Poly, I think this is on-campus numbers, have not changed at all in the past couple of months. And so we're just wondering how the county is reporting those cases, and also, Cal Poly is going to be administering vaccines. Are those going to be reported as part of the normal,
Yeah, so let me answer that second question first. Any vaccine that is administered in the state of California is required to be, the information is entered into a state registry. We use the California Immunization Registry, CARE. In this county, Cal Poly will be using that system. They are live on that registry. With respect to, I'd have to go back and look. It surprises me to hear that the on-campus number has not gone up for a couple of months, because I believe that there have been some cases. I will go back and look at that and get back to you.
And can you speak to Cal Poly's, like the student population's role, or actually the Cal Poly community's role in increasing number of cases in the SLO area? I know that side of SLO has seen way fewer vaccinations, probably because people just became eligible pretty recently.
Right, so Cal Poly has begun their vaccination efforts this week, and we are allocating them quite a large number of doses. They're able to do it on campus. We encourage, just like the rest of the population, that they all take advantage. In terms of the case counts, Cal Poly does continue to represent a non-insignificant portion of our cases, but it is, it is less than half, considerably less, and so I message Cal Poly University, the students in particular, but any members of our community who believe that this disease is over and we can take our masks off at this point and we can party. We're still not there yet.
Okay, and then with MyTurn, can you share, for people who aren't familiar, how is that different, like the setup and all of that, how is that different than the county system? Is it substantially different? Is there anything really different about it?
So if you're a lot of, like me, getting comfortable with a new application and, working your way through a registration form might take an extra few minutes. So the look and feel of it will be different. However, different from the county also is that instead ours in the last month, 2 months, I'm not sure, was a process of registering to be selected for an appointment. With the MyTurn system, you will be able to make an appointment as soon as you go online if there's an appointment available. So you either need to check back if there are no first dose appointments available, or second dose for that matter, or make your appointment right then and there.
Okay, so the lottery system is not continuing.
That's right.
Okay.
All right. Thank you.
Thank you all for being here today. Just a few closing announcements. You can still get all our county's COVID-19 information on readyslo.org or recoverslo.org/vaccine. Our phone assistance center remains open. It is now open Monday through Friday from 8 a.m. to 5 p.m. And our recorded public health information line is available 24 hours a day, 7 days a week. As of today, as Dr. Bornstein announced, SLO County has transitioned to MyTurn, the state's online COVID-19 vaccine appointment system. We have updated our website with a new link and phone number for MyTurn. Those are also available. That information is available on the slide behind me. If you were in our registry and have been awaiting an opportunity to make an appointment, you should have received your final notice today and an opportunity to schedule that appointment. If you are uncertain about your registry status or have trouble using a computer, please call our phone assistance center for help at 805-543-2444. Going forward, MyTurn will be the method of making appointments, both first and second dose appointments, at our county vaccination site. You can also search availability for vaccine at many of the private providers in the county at vaccinefinder.org. Free COVID-19 tests remain available at several locations around the county. Please go to emergencyslo.org/testing for locations and details. You do not need to make an appointment, although they are still encouraged, and generally results are available within 48 hours or less. You can continue to watch these briefings live on our county's YouTube channel. They are also broadcast on SLO County Public Health's Facebook page after the event occurs, and on Public Access Channel 21 at midnight, 8 a.m., and 5 p.m. until we broadcast live again. Thank you once again for staying informed. Be well, and we will see you here on Wednesday, May 5th at 3:15 p.m.